I want to introduce a little background on how women's reproduction works. My name is Dr. Sharon Moyeri. I'm owner and founder of OC Fertility. So women, we're born with all the eggs we're ever going to have, unlike men who make new sperm every 2 to 3 months. So if you look here on this diagram, here's an example of an ovary for a woman who's in her 20s on ultrasound, and this is a schematic of the same thing. For those of you who don't read ultrasound that well, this here is an ultrasound of a woman in her 40s, and this is a schematic of the same thing. The first thing you can notice is that this ovary is way bigger than this ovary. And so that makes sense because if we're born with all our eggs, our ovary is going to get smaller and smaller as we age. The other thing you notice is that there's a lot more black little dots in this ovary compared to this ovary. And those black dots are what we call follicle cysts. Follicle cysts are normal in reproductive age women, and inside each follicle cyst resides an egg. We can't see the eggs, they're microscopic. They're about the size of a dust particle, but the follicle cysts, some of them are visible on ultrasound, and we call those antral follicles. We certainly can't see all the eggs in the ovary, but we can see the antral follicles, and those antral follicles are the follicles that are recruiting eggs to be ovulated over the next several months. When we do an ultrasound, we can get an idea of a woman's egg count by measuring the antral follicle count. So we're really not looking at the eggs, we're looking at the antral follicles, or those follicle cysts. You'll hear us talk about eggs and follicles interchangeably, but they're really not the same thing. So here you can see in this ovary, there's about 10 antral follicles, and in this ovary, there's maybe 2 to 3. And that makes sense, because for a 40-year-old, you don't expect to see a lot of antral follicles, but for a woman in her 30s or 20s, you expect to see a lot more antral follicles. Why is that important? It's particularly important when you're talking about treatment, but it also gives us some idea of a woman's aging in terms of her ovarian aging. And so if I were to see a woman who's 20 come to me and she wanted to know about her fertility potential, one risk I might identify in her is lower ovarian reserve if I were to look and see an ovary that looks like this. It doesn't tell me if she can get pregnant or not, but it might predict that she's going to have problems, especially if she doesn't have many eggs to begin with. So some of this doesn't really matter because typically women are only ovulating 1 egg at a time. We don't make litters, we make 1 baby at a time. But these are all the applicants for the job. So if you were to look at the ovary mid-cycle, when a woman's getting ready to ovulate, which is this image over here, you can see one of these cysts is swollen compared to the neighbors. That right there is a follicle that's housing the single maturing egg for the month. Really, that's the egg that's going to be ovulating, and that's the one that will be released around mid-cycle. These other ones are going to shed and leave the ovary as well. And so it's not true that we only lose 1 egg a month. We actually shed lots of eggs, and those eggs start to shed even before we're born. So by the time a woman hits puberty, she's already lost many, many eggs. And by the time she's ready to reproduce, especially nowadays, since many of us wait until we're in our 30s, most of our eggs are already gone. So why is this so important? It's really important because we capitalize on that knowledge in order to plan our treatments. So we can introduce medications in the form of hormones, and those hormones are called gonadotropins, which are fancy words, but they basically are hormones called FSH and LH that can basically reroute the destiny of some of these shedding eggs or antral follicles to join the one that's already going to ovulate that month. So for instance, if you look at this image up here, we can see that there's lots of these big circles or lots of these maturing eggs, and that's because we introduce the same hormone that our body's producing to get this follicle to mature the egg inside of it, to recruit the neighbors to also ovulate the eggs inside of it. So instead of just ovulating a single egg for the month, we could potentially ovulate multiple eggs that month. Obviously, we don't want this woman who's ovulating these eggs to get pregnant naturally because she's likely to have many, many fertilized, but this would be a perfect situation to potentially go and extract the eggs. So oftentimes we get the question asked, and sometimes through Dr. Google search or through talking with friends, is how come one woman's able to get, say, 20 eggs and another woman's only able to get 2 eggs? Certainly protocol can play a part in that, but a lot of it has to do with biology. So if you look here in these images, you can see in this ovary, there's only a couple antral follicles. So no matter how much medication I give this woman, there just aren't more eggs to be had. Whereas if you look in this ovary, there's lots of antral follicles. So if I dose that patient appropriately, I have the potential to get a lot of eggs from that woman in 1 cycle. And if you think about it, that woman could potentially retrieve in 1 menstrual cycle what would take her ovulating a single egg at a time 2 years to accomplish. And those eggs haven't aged 2 years. So that's where we really start thinking about fertility preservation being very effective. So part of the reason I like to talk about this is that so people really understand why we do what we do with our treatments and why we introduce medications in order to do what's called superovulation or ovulation induction. People use different terms for basically the same thing. We're primarily trying to get the ovary to either ovulate in women who aren't ovulating, or for women who are already ovulating, trying to get them to ovulate more eggs in a shorter amount of time or more eggs within one menstrual cycle. And so we can give medications to do that, and that provides more targets for the sperm, and it gives a higher opportunity statistically of finding a healthy egg in those women who may not have as many healthy eggs remaining.